Happy Facebook Live Friday at Mystique, guys. I'm Barbara, the practice administrator, and thank you so much for tuning in. We're going to switch it up a little bit this year, guys. And after we do a treatment, we're going to spend the next week talking to the patient, talking to the person that received the treatment, so that way you guys can know what happens after they leave here. We seem like we're having a lot of fun, laughing at all sorts of things while they're getting the treatment done. But what happens when they get home? What is the aftercare like? What are some maybe questions that you guys might want answered before you come in to, to see if this might be the right experience for you? So we're going over CoolSculpting and IPL. We did both of those from last week. We're going to focus our conversations on CoolSculpting today. And if you guys have any questions about IPL, make sure you submit those and we'll make sure we get those answered. But we're going to bring Shalene, your guys' most love injector of 2017 from Real Self. She was our CoolSculpting IPL model last week. So Shalene, will you come join me right here? Okay, so Shalene, you had CoolSculpting done on your lower stomach last week, right?
Yes.
So what did that feel like?
It's really very comfortable. Initially, when the applicator goes on, it's a little cold. You feel a little suction. The coldness goes away within a couple minutes, and then you just chill for a while.
I have to agree with you in that we know I'm a big fan of it. I feel like night and day difference from those old applicators, and I will repeat, we are the only office in town with 2 full sets of those new applicator guys. That makes a huge difference in the comfort level. So that's, Shalene actually had the larger applicator, which I had as well. I've had that done twice now on my lower abdomen, and that's where I feel like we've seen really drastic results from that large applicator. So the comfort level being that great, or the pain level, I guess, being that low on that larger applicator is really impressive. That they've, remodeled it, been able to reduce the suction by 70%. That's huge. So we're always honest. Anyone asks, we tell them just how it is. So what is the worst part of that treatment, do you think?
I would say the worst part is afterwards, the kneading. Yeah.
The 2-minute massage.
The 2-minute
Okay,
massage.
guys, let me tell you something. And I've said it before. That 2-minute massage, Shalene does not like it. I do not like it. Courtney, I think I almost kicked her last time she massaged me. That doesn't mean it's okay for you guys. But that 2-minute massage improves your results by 68%. So when you know that, Shalene, is it not so bad?
It's not so bad. It's really not that bad to begin with.
Yeah.
Really, it's very tolerable, but definitely when you know your results will be increased by that much, it's doable.
Just suck it up.
Exactly.
We're women, we could do it. So what did you do before the CoolSculpting treatment? Like, did you prep? Did you have to eat a certain nothing?
No,
You have to wear certain clothes?
No, I just wore loose, or comfortable clothes for the treatment because,
Yeah.
I'm going to be sitting there for a little bit.
Yeah,
but,
45 minutes.
Uh-huh.
45 minutes,
Mhm.
which is down from the hour. I think it was an hour and a half on that old applicator. I can't honestly. We don't know because we don't have it. So don't go experience that. So after you went home, so yeah, we did that around lunchtime, I think it was. So when you went home that night over the weekend, did you have to do anything differently? Did you have to wear any different clothes? Did you have to avoid doing anything?
No, I didn't. Little tender on my stomach if I were to push up against the cabinet or counter or something. But other than that, you don't even really know you've done anything.
Which I have a little story, guys. We went on our work retreat, if you guys have been following us on Instagram since August, and Amanda and I surprised the entire staff with zip lining. So one might think, yeah, that's great, but I had Courtney, your guys' nurse that does the CoolSculpting, she didn't know that we were going zip lining, and I had her do a treatment 2 days prior to that, or the day prior.
I think the day.
Oh, it's 1 day prior. I would not have put Courtney through that if I thought that was going to be a miserable experience. Courtney went on every zip line with us. It was a ton of fun. If you guys need zip line advice, we'll give that to you too.
Right.
So you didn't do anything differently. You could have worked out. You and I don't like doing that,
No,
obviously,
but
we could have. Okay, so any side effects? So Shalene, you're a good person to talk to right now because you had a side effect that can happen. It's something that's definitely possible, but it's rare. You had a bruise on your stomach. So when that machine sucks your skin, I guess, and your fat, the subcutaneous fat, into it, there is a vacuum that takes effect. There are many factors why someone can bruise, from blood thinners, even taking aspirin that morning, fish oil, St. John's wort, something like that. It's definitely something that's possible. It's not something that happens all the time, but something that resolves in a few days, just like any other bruise would.
It's already much lighter Well, actually, I had another treatment, but yes.
Oh, yeah.
Sorry.
Shalene's getting it. Shalene's getting her treatments in over here, guys.
Got sidetracked. The bruise was much better the next day, though.
So, and you returned to your normal activities.
Yes.
Big question. Well, I was gonna say, would you get this treatment again? But you just
Well,
gave away the big ending.
Sorry, I just did it again. So yes, I would.
Yeah.
Absolutely.
I'm at 14 cycles now, guys. So let's explain a cycle to them. So the applicator locks onto you, that uses suction and stays on you for about 35 to 45 minutes depending on what area it's on. Every time that one applicator on one of your arms is one cycle. So to do both your arms would be 2 cycles.
Right.
So I've had 14 cycles. The only area I've doubled up so far, I've done my flanks twice and my stomach twice. And that was after the second treatment is when I can really say that people started telling me that they saw a difference. After the first one, I was excited about it, but other people started getting excited for me. Just walking around the office in my clothes, obviously. Not at the point where I'm going to walk around here in a bathing suit. I promise you, when I get enough CoolSculpting, that day will come. But yeah, it's a great treatment. So your life's been pretty easy last week. Yeah.
No changes. It's
So,
no restrictions.
Did you experience any numbness?
Slight numbness. More just you touch the surface of your skin. It doesn't quite have as much feeling as another body part.
It's almost when your arm's about to start falling asleep.
Probably.
Right?
Like
Is that what that?
Yeah.
That's how I feel.
Yeah.
It's nothing that is uncomfortable.
No.
It's just you are aware of it if
Right.
you, like you said, rub up against the counter or something like that. So, okay, ladies and gentlemen, that is our Q&A with our RN Shalene here for CoolSculpting. You guys, there are probably 1,000 more questions that can be asked. Please don't hesitate. Email me personally, BarbaraK@MystiqueMedicalSpa.com. You can go to our website. All those contact forms go to me. Give us a call, 447-LASER, if you have any other questions. We'd love to answer those. Otherwise, guys, stay tuned because we're bringing in a brand new treatment. If you guys watched the video a couple weeks ago, we're bringing in a brand new treatment to the practice this next week, and it's going to be on Facebook Live next week, which means we're giving it away. So tune in. We can't wait to see you. We hope you have a wonderful weekend, and we'll see you next week. Bye.